Hi, in this video I want to show you how to bandage a cannon or a shin bone. The first thing you need to decide is what bandage you want to put or what covering you want to put over the wound. You've got a few choices. The thing to make your decision is how fresh is the wound? Is it a really fresh wound that you've just found? In that situation, the animal Intex poultice is the best one to choose. This has a drawing ability, so it can actually draw out any dirt and gunk that you may have missed when you cleaned it. It is a bandage that has a plastic side and a not plastic side. If you tap that, you can feel like a chalky substance come out, and that's the drawing ability of the bandage. This part goes to the wound and the plastic goes away from the wound, and that just helps draw all of the muck and gunk and everything into the bandage, and it doesn't seep through to the outside of your bandage. If it's not so fresh and the wound has been poulticed and is nice and clean, or it's been a sterile wound under surgical conditions, you can use this melanin bandage, and this has a shiny side and a not shiny side. And this bandage is opposite because this shiny side goes on the wound and this side goes away. And that allows, when you put honey or what sort of dressing you want to put on the wound, you put this over the top, and when you take the bandage off, it doesn't rip that healing bed off, it just comes off nice and neatly. Where you find if you leave the animal Intex on for a day or two, you've got to really sort of pull it to get it off the wound, and that can cause bleeding and damage. So this is good for wounds that are a bit older and have been cleaned and bandaged. So today we're going to use the animal Intex. So I'll just grab my animal Intex. I'm just putting a rip wrap bandage over as well. I've been bandaging for quite some time now, and so I'm aware of the pressures I need to put on the wound. If you're not quite so familiar with bandaging, you are better off putting a padding over the top of the dressing before you put this on. So I'm just going to ask my horse. So you can see the wound there. It's nice and fresh. You can see it's nice and pink there. I'll just ask it to lift. Oh, actually, no, I won't ask it to lift a leg. I'll cut that bit out. So this is the wound here that we've got. Now these white bits here and here, they just basically indicate little bones that are under the skin there that you don't want to put pressure on, because you can cause issues when you're putting too much pressure on those areas. So I've just marked those out so you can see. If your wound is anywhere on this cannon bone here, I like to use anchor points. So I bandage from the pastern up and then over the knee, because that won't allow my bandage to slip. So I've got these anchor points. Even if it's only a little wound here, I still like to bandage the whole way. If you just bandage this area here, you often get a bit of the bandage slip down, and that can cause rubbing on the wound, which can then cause damage to that wound. So you want a nice healing bed to occur. So what I tend to do when I'm by myself, I start with the pastern. And again, I'm pulling the bandage off, and this is it's very giving, this bandage, but if I pull it to its full extent and then wrap it, there's no give in that bandage, and it can constrict down on your horse's leg, causing problems. So I'm just going to go around the pastern there, and then coming up, so I'm just going to apply my animal Intex to the wound. Then I'm just going to go up over that little bone there, and then continue on up. Continue on up. And then when I get up to the carpus, I'm just going to go up over the carpus and back around like a figure of 8. So you can see I'm just avoiding that little pointy bit of the bone there. And again, I'm just going to go up and over. And then I'm just going to cut this bandage off. You can rip it often, but you just have to be careful that you're not causing tightness and whatnot onto the leg there. So I'm just going to cut that bandage off and stick it down onto itself. So the other things to keep an eye on is that you're not too tight here. So that's where my wadding bandage is there. So you just have to be careful you're not putting too much pressure on those tendons at the back there. And you can feel when you press down that that's not too tight. It looks as though it cuts in there a bit, but that's just because that's where my bandaging is. So now the other thing I'm going to do is just apply a little bit of elastoplast at the top here, just to stop that from slipping down. Not that I think it will, but just as a precaution. So I'll just grab some Elastoplast. And again, I'm just putting it on the bandage once, and then just up over the leg. Now, the horse that I'm bandaging here is one of mine, so I'm very aware of her temperament. If you're bandaging someone else's horse, just be mindful that they may not be comfortable with you bandaging their leg, and just be careful that they're not going to strike out or hurt you. So sometimes it's best to come to the side when you're wrapping the legs. So that's the cannon bandaged. Thank you.